Well, now at your feet at 5, trending in the right direction. Our COVID numbers continue their nosedive after seeing daily case counts in the 20,000s for days in December and really into much of January. Today's COVID case count is 4,176, and that's now 7 straight days that we have been under 5,000 daily cases. Hospitalizations also down dramatically. About a month ago, we had nearly 7,000 patients in Ohio hospitals with COVID-19. Today, that number's down to 2,669. In fact, COVID patients now take up about 10% of hospital beds statewide. Compare that to just 1 week ago when that number was 14%. So yes, this is all encouraging news, but today, the Ohio Department of Health said we cannot let our guards down just yet. Sarah Shookman puts it all in perspective.
Coronavirus cases in Ohio are dropping sharply.
We're getting closer, but we're just not there yet.
The state's health director says we're still seeing high levels of transmission, though. At the peak of the Omicron surge, Cuyahoga County saw 3,000 cases per 100,000 people. That number is now down to 189, under 100, and will be out of the high-risk range.
While there's no doubt we are quickly moving in the right direction, it's simply too early for us to declare victory.
With more people testing at home, case numbers may not be as accurate, but all Ohio's monitoring, including wastewater, testing, and hospitalization, show the same declining trend.
But I think what we've learned about is preparing for the next. We know that Omicron or coronavirus is not going to go away.
Tomorrow, Pfizer will release its study data publicly as the FDA and CDC consider vaccinating kids under 5 years old. The company already reported 2 doses failed to produce a strong immune response among kids aged 2 to 4, only meeting the target for kids 6 months to 2 years old.
So I think a lot of it comes down to how close of a miss was it? And we just won't know until we see the data tomorrow.
NBC News reports the FDA actually asked Pfizer to apply now while researching a 3rd dose to start to build immunity for the littlest kids. UH Rainbow's Dr. Amy Edwards says it's hard to predict what happens next.
Omicron's moving with such rapidity. It'll be interesting to see over the next week or two whether that urgency continues to be necessary.
Now, Dr. Edwards told me she's been very clear to parents, do not get your hopes up yet. In case approving a vaccine for those under 5 still takes until late spring as earlier predicted. But tomorrow we are likely to learn more, Jay, ahead of that FDA advisory panel meeting next Tuesday.
All right, we're anxiously awaiting to hear what comes from that. Sarah, thanks.
Sure.